we got to do a real live user acceptance testing on our prioritization through the pandemic, because we had, before the pandemic hit, we had worked on what we call our must-win battles, those things that we really have to be good at, whether that be in our corporate systems, whether it be interactions, omni-channel with our healthcare professionals, e-commerce, supply chain connectivity. We created a idea around these must wins we had to do with roadmaps and product roadmaps and deliveries we need to install with alignment with our business. So it wasn't, this was the business strategy, and then here's the technology strategy, and hopefully they come together. It was actually integrated. To achieve this business strategy, here's the roadmap of capabilities we need to enable, and this is what was most important to enable the highest outcome. We took that same approach when COVID hit, and we said that the methodology works. Now the outcome is somewhat different, where now we're focusing on patient safety and getting some critical supplies to market, employee safety, and making sure that our on-site workers will be really effective, and ensuring that unmet medical need was going to happen, even though hospitals were shutting down, even though, or not allowing sales reps to go in, even though we had to get our message out. And so we were able to reprioritize using that methodology. And the really amazing thing was we were all aligned on the same outcome. It wasn't just I had to deliver a technology solution, the business had to deliver a key message to a healthcare professional, supply chain had to deliver a product. We all aligned on ensuring we had supply. We all aligned on ensuring employees were safe. We all aligned on making sure we can keep connectivity with our healthcare professionals and the patients that we serve. And that drove our agenda. And all we did was we took that methodology and repurposed to where the new priorities were and anchored the organization on that. And as we come out of the pandemic, and it will end eventually, we take that same methodology again, and what's the unmet need that we have to fulfill, and making sure we're laser focused on those outcomes. I think the learning of the organization, the company at large, what would have taken us probably months or years to test, a pilot, we had to do in weeks. And what the organization started to learn is this ability to be agile, to be adaptive, to be minimal viable product, and then adapt as you go, because we were getting information daily. New insights. We had to move our whole global services, which is kind of the call center for employees, offsite. And we had to do that in days. So we had to make sure they were connected to our systems, that was secure, and they could get the call centers and calls, and we were able to redirect that. Even what happened with our partners, India shut down, and a lot of our support comes out of with our partners in India and other parts of the world. We had to keep them connected. So there was a ton of things we had to do to make sure the business operates. We maintained delivery of critical life-saving products. We kept our employees safe, and we kept connections with our customers and patients. And that was the learning opportunity and the things we were able to amplify as we've gone through this pandemic, but do it at scale and speed. Well, it's been really exciting to work with our business colleagues at J&J, because they've actually adopted agile methodologies. If I think about our consumer health business, they're actually using agile teams as they think about product development. If we think about our digital surgery offering in our medical device division, we're actually applying agile thinking as we connect hospitals. We connected with data, we connected with digital surgery and robotics. So we have a platform for lung cancer, we have a platform for hips and knees, and we have a platform for general surgery. Using agile thinking to continually iterate, how do we make sure it's the best experience with the best outcomes? We're applying that. If we think about our pharmaceutical space, applying data science at scale and agile ways to support our enrollment or HCP connections, or supply chains, another great example where agile thinking is going into applying how to reimagine supply chain, not just drive efficiencies, but actually reimagine how we deliver a product to a surgeon or patient that needs it. And then we've done a ton with intelligent automation. And even there, it's not just about driving efficiencies, but how do you reimagine processes? And using technology with great business thinking and leadership, coupled to an outcome we all are aligned to, we've been able to show and translate and accelerate all these opportunities. And I think, as much as money's being spent in technology and healthcare, I think we're really just starting. And there's so much new opportunities I think we can bring as we bring the whole organization, 135,000 employees, being kind of what we call digital natives, and embracing it and taking their domain knowledge with the technology and the acceleration with a common outcome. And we can really transform the trajectory of human health. And then because we've had so much demand on the technology, the whole organization's eyes have opened, whether it be intelligent automation, whether it be data science, whether it be data itself, whether it be E-commerce. We were able to grow our e-commerce footprint dramatic fashion, which had a lot of value, because if you think about consumers, they needed, their various consumer goods, and e-commerce became a way to accelerate getting those products to them. So there's been a ton of learning. And if anything, I'm challenged is our CEO said to me, wow, it's amazing what we've been able to do with technology. The bar's been raised. How do we now take it to that next level? Because now the appetite is, we understand the value, but we're just starting tip of the iceberg. We expect so much more now. And so it's a rallying cry for me. It's a rallying cry for my organization, which I'm super proud of. And it allows us to elevate our game. And technology not being more important than the science, not more important than the patients that we serve. They're always at the center of what we do. But technology plays a critical role to deliver on our mission and purpose for the company. I was here about a decade ago. The first thing we did is say, what's our purpose? We created a purpose statement of what we wanted the technology function to be. And it goes as follows. We shape the future of healthcare by unlocking the power of people, technology, and insights. Shape is an important word. We have to shape healthcare, anchored in J&J's mission of transforming the trajectory of human health. We have to unlock the power of people, the whole company, 130,000 employees, through technology and insights. So we have a real opportunity to help in a mission that we all deeply care about, that is important to every one of us, because we all need healthcare and we all need innovation. And I think it's a tremendous opportunity for technology to play a part, a really significant part in that future. And I would say the true of any company that you're in. You've got to own that, and you've got to drive that. If not, the business does not wait. They will go. You've got to be there. And even when I look at my own organization and being future ready, there's a lot of work we do to make sure the talent is there. We're using AI to avoid bias in our selection process. Diversity and inclusion is absolutely critical to our success as a company, and we invest heavily in that. And so these are all aspects I think technology really needs to step up and lean in. Otherwise, they will do it anyway, and you will be left on the sideline, and you miss the opportunity. And it really anchors in I start with our purpose. What's our strategy underneath it? There's 3 pillars: modernizing our tech ecosystem, talent, which is not just talent in my organization, about 5,000 people. It's actually talent for 130,000 people, and growing and developing that. And the third bucket is accelerating business outcomes. So we clearly position talent as a core element of our strategy, so people know we're serious about it. And then as we unpack talent, what we've been doing is we've been looking at, what does future ready mean? What are the skill sets and the competencies that we need to really be the thought leaders, back to my purpose, shape and unlock and build that skill set? We also have to be really honest and open. Where are we against that skill set? And we've been doing some pretty neat things with AI and inference engines that allows us to take external de-identified data, marry that with our internal data, and look at what are the skill gaps and skill strengths we have in the organization. So I have a heat map now against some of our 40 capabilities that we've highlighted around where we're strong and where we can develop. And now we're taking the plan of, now we know that, how do we now build that with learning curriculum? And how do we tie that to marketplace, which basically is, here are the jobs to be done with skills that we want. Here are the skills that we need. Here are the experiences we want our employees to have to develop. And how do we align those together? Because we all know taking a course on its own is not going to move anything. You got to tie it to experiences. Now, go back to your point about attracting and retaining talent. We believe on a couple things. We think our mission is really important around healthcare. That in itself has got an amazing draw for a lot of people that want to have an impact in healthcare. Second, we're highlighting, even in calls like this, the importance of technology to that mission. So if technology is critically important, you can attract and retain the best talent because they're interested in the mission and they want to go to a place where technology really is valued and matters. And then third, we create a process by which we continually learn. We continually develop ourselves. We're never satisfied. We're always in beta, as we say internal now, that we're always a learning organization, because the comment I make to my organization is the half-life of a technology is about 18 months. Technology is changing that rapidly. If we aren't continually challenging ourselves, we can't have the value I want to have for our company. And that's not okay. We have to have that value because patients are waiting. We need to support them. So that combination, and if I add inclusion and diversity, not as a side effort, it's core to what we think about and what we do. And we make that a material effort that we're inclusive, we're diverse, diversity of thought, diversity of gender, diversity of sexual orientation, diversity of geography. All of those matter, and skill set as well, because only then can you get the best outcome. So those are the things we think are really important to us. And for those that are important to them, they'll come to us. If it's not important to them, they won't be here anyway. But we do
Right.
think that's an important draw. So we need both external and internal. We have to have the mechanism. We got to measure ourselves. We got to be transparent where we're at, and we got to continually learn. But you want to do something at scale. You want to do something that you can get you the global reach. Wow. I think about the number one healthcare company on the planet, J&J. I can't think of a bigger one or better one to do it in. So granted, I'm not the most unbiased person with that statement, but I've worked with great companies, with great people. I've taken those experiences throughout my whole career. I've valued every single one of them. But you can do great tech if you're energized about it, in a mission you care about, that you're driving it and you're relentless about it. The only person that's stopping you is you.